Joining us now from Frankfort is Kentucky Governor Andy Beshear. Governor, you are nearing the end of a 2-week quarantine with your family. What has that experience taught you?
Well, first, my family's doing great in the midst of this. Nobody wants to have to quarantine, but I get to do it with the 3 people I love most in the world. And I'm going to try to take that as a blessing each and every day. What I hope people have seen from it is I'm going to do the same things that I ask other people to do. And it's critically important when a contact tracer reaches out and says you've been around somebody who was positive and infectious, that you do what they ask. You make sure you do the quarantine so that the virus doesn't spread any further. And while my entire family is negative, we've tested negative 3 times now, we are going to continue to stay in quarantine until the Department for Public Health releases us. What I found is you can be really productive working from home, like a lot of Kentuckians out there are doing it. I'm as busy as ever. We are making some real strides as a state in some really special areas that I look forward to talking to later. Now, it is a challenge to stare at a computer screen that long during the day, but a very small inconvenience for trying to make sure everybody out there is healthy and safe.
I think we could all agree we stare at a screen maybe a little too long. Governor, you've indicated that surge preparations are underway in the Bluegrass. What makes this 3rd peak in COVID-19 cases more dire than the resurgence we saw after the 4th of July?
Well, certainly the most concerning surge was the initial one. And when we think back to March and April, and we didn't have enough PPE, even individuals working in hospitals were having to use subpar PPE. We didn't have the level of testing, not nearly the level of testing. In fact, we were having to ask people not to get tested. We didn't know as much about the virus, and because of that, nationwide, we had to take some real serious steps to lessen the virus and to buy us time to address all of those concerns. The second wave we saw in July was happening regionally, wasn't happening nationally. We saw places like Florida, Texas, and Arizona really just devastated with a significant loss of life. That's when we put the mask mandate into effect and were able to level off. This 3rd escalation concerns me more than anyone but the first one for a couple of reasons. One, our levels are the highest they've ever been. Right now, I think we're averaging over 1,000 cases per day, and in a state our size, that is not a good place to be. The second is that it's not just cases going up, because cases went up in July, but hospitalizations and ICU usage are going up too. And that didn't happen to the degree in July that we are seeing right now. And the third reason is that it's happening nationwide. And the 4th is that it's going into fall and winter where more people are going to be inside. Because of that, we're going to make sure that we are ready. We've been preparing for this from a logistics standpoint, from the PPE and the testing standpoint since March, since the beginning. But it's certainly one that we want to avoid. We want to stop this surge. And the best way you can do it is wear a mask. Keep gatherings at your home really small. Cut down on your contacts. Practice good hygiene. Make sure you're following those guidelines that are out there. This is all in our hands. And when we have 1,000 cases a day, we have a significant amount of death that follows that. And it's in our hands to lessen that loss of life and that harm to families and the sickness that this can cause. So I believe we're up for it. I believe Team Kentucky is just taking their breath and getting ready to go back into battle, and that's where we need everybody.
And the last question, Governor, the state recently released preliminary plans for distributing a COVID-19 vaccine. It divides the Commonwealth into 3 groups to receive that dose. Because of the likelihood of that limited availability, does it concern you that on top of that supply restriction, recent polls are indicating that roughly 40% of Americans aren't even interested in getting a vaccine?
Well, I'm really excited about the speed of the vaccine, and I look forward to the challenge of getting it out there and talking to people about it. I'm not going to ask anybody to take anything that I don't believe is safe and that I won't take myself. and that my family won't take. And so I can promise the people of Kentucky we'll communicate about the safety. We'll tell you all the pluses and minuses that we know of at the time. And again, I'm not going to ask anybody to do something that I won't do. Just look at me. I'm right here in quarantine. We are going to have limited supplies at the start. And the length of time that it will take to vaccinate those that are willing all depends on the approval time and then the manufacturing, how quickly it can get out there. We have set up a plan where those that need it most get it first, and we're going to have to ask people to be patient. A lot like when we were telling people, unless you're really sick, don't get a test. When we had very few tests, the first round of vaccinations, I think we'll only have a little under a couple 100,000. So think about everybody working in healthcare on a COVID wing. We need to make sure that they get, for instance, that vaccine first. If we are younger and healthy, we want to make sure that those that are more at risk get it before we do, that first responders that are exposed to more get it before we do. So we're going to be tested again, but I'm like we were when early on in March when the vaccine comes out, but I know we're up to the challenge. And right now the vaccine's being discussed right in the middle of a presidential election with a lot of politics. I think when we've got a chance to talk to people about the science and the studies, that they will be confident and can be confident that it will be a good thing that will help them get at least to a new normal. Not the old normal, but a new normal where hopefully we don't lose our compassion, how we care about each other, and have an even bigger and brighter future moving forward.
Kentucky Governor Andy Beshear, thank you so much for taking the time to speak with us.
Thanks for having me.